Mayo Clinic presents
Emergency Medicine Grand Rounds.
Hello and welcome to the Always On EM podcast. This is Venk Libenkomycin, one of the hosts of the show, along with my dear friend and amazing colleague Alex Finch. I want to welcome you to the final release of the 2024 calendar year and the conclusion of Season 3 of our little show. It's been a beat since we had a true Grand Rounds release, and we have one of my favorites for you today. But before that, thank you so much for tuning in this past year. Also, thank you to our incredible educators who taught us this past year that so many wonderful people, perspectives, coming together for our collective benefit. Also, since this is the last time we will talk together this year, Happy New Year from Alex and me and all of us here at Mayo Clinic. Merry Christmas, Happy Hanukkah, joyous Kwanzaa, fantastic Festivus, and truly have a tremendous holiday season, however you choose to celebrate. Alex and I have some hopes for how to raise our game for the next year, so we resolve to keep trying to help make your day better for listening and help you be your best for the patients in front of you. Please continue to check us out. We really, really appreciate it. Okay, so when I think about this particular Grand Rounds, I want to share a little context. This is a recording from the last academic year, and one of our third-year residents at the time, Dr. Adiba Matin, she took on the challenge of a topic that you cannot just look up in a book or look up in a research database for the content, mainly because it's a projection into the future. She planned for a long time and collected advice and insights from a variety of sources with expertise that come together to create this amazing presentation. In addition, her talk becomes even more relevant as I think about the fact that just this last week in Minnesota, the temperature mid-December was 50 degrees Fahrenheit. That's 10 degrees Celsius, when it typically should be closer to 15 degrees Fahrenheit, or about negative 10 degrees Celsius. And she is going to talk about climate change as it might pertain to our future in emergency medicine. And she does an amazing, amazing job. In just a second, you will hear a more formal introduction of Dr. Matin by Dr. Jihan Khaledi, who does an outstanding job at that as well. And so put some extra marshmallows in your hot chocolate, grab some holiday candies and cookies, and sit down. And here we go.
It is an absolute honor to introduce our Grand Round speaker for today, Dr. Adiba Matin. Dr. Matin completed her undergraduate degree in biology at the University of Chicago, where she graduated with honors. She went to medical school at the University of Missouri, Kansas City, where she was selected for AOA during her junior year. We were thrilled when she decided to pursue her training here at our program. Among Adiba's many academic accomplishments, which are too numerous to list in an introduction, are that she was a national delegate of the AAMC. She is an advocate for equity in healthcare and has been involved in multiple organizations and research projects to promote an awareness of disparities in healthcare faced by minorities and certain socioeconomic groups. And she has spent much of her time volunteering at hospice centers. Dr. Matin received a scholarship from the Mayo Clinic International Health Program to do a rotation in Bangladesh last May. She was also chosen from her residency class to attend the Resident Leadership Academy last year. Fun fact, Adiba worked as a project manager for our beloved EPIC in between undergrad and med school, so you can direct all of your EPIC questions to her. Adiba developed a strong interest in bioethics during medical school. She was the founder and president of the Society for Bioethics at her medical school, where she contributed and facilitated the production of greater than 15 articles, organized lectures on medical ethics, and other educational opportunities for members. She was also a student member of the Truman Center Ethics Committee and has done research in bioethics that has resulted in several publications and presentations. Aside from her extensive academic accomplishments, Adiba is an outstanding clinician. Her work ethic is among the best that I've seen, and she truly cares about learning as much as she can so that she can provide the best possible care to her patients. Dr. Matin will be speaking about a topic that is near and dear to her heart today, which is climate change and how it relates to emergency medicine. So without further ado, I introduce Dr. Adiba Matin, our Grand Round speaker today.
Thank you, Dr. Khaledi, for that introduction. That was way too kind. For those of you guys who don't know me, I'm Adiba. I'm a third-year resident in the emergency department. And today I'd love to speak to you guys about climate change and how I think it's going to relate to emergency medicine. So this is a video, a very short clip that I took in my month working at Barda Medical Center in Dhaka, Bangladesh, where I worked to see the inequities that occur as a result of climate change in medicine. And I was kind of aware of climate change, but I didn't really understand how it was affecting people today, and especially affecting marginalized populations. This experience really enlightened me because I was able to understand how disadvantaged populations are affected disproportionately as a result of climate change, and learn how specifically Bangladesh is affected. So for those of you who don't know, Bangladesh is a very small country just to the east of India, and my family is from there, which is why it's a place that's kind of dear to my heart. And the World Bank has noted that Bangladesh is one of the most vulnerable countries in relation to climate change because of its location, its population, its current infrastructure, and its propensities for natural disasters. So that brings me to my talk on climate change in medicine. I'd like to talk about 4 topics, which are heat-related injuries, air quality, exposures, particularly infectious disease, as well as toxin exposures, and then social determinants of health. So the objectives of this talk are going to be to counsel patients on the implications of heat and air quality recommendations, to identify pathology related to infectious disease as well as toxin exposure, to understand how climate change can impact social determinants of health, and then maybe inspire people to advocate for climate change. So our world's climate is changing. According to the National Oceanic Administration and NASA, 2023 was the hottest year ever recorded. And of the top 20 hottest years, 16 have occurred in the last 2 decades. This is thought to be secondary to El Nino as well as the effects of global warming. And El Nino is a natural cyclic climate pattern that can push global temperatures even higher than what we can expect. And many of the hottest years ever recorded have been secondary to strong El Nino conditions, which will be present in 2024. And there is a 30% chance that 2024 will actually be even hotter than 2023. And this has an impact on our environment. Climate change and air pollution have driven the emission of greenhouse gases, particularly carbon dioxide, methane gas, and nitrous oxide, which ultimately end up trapping heat into the atmosphere. And we currently have data on how this is impacting the temperatures of our country and worldwide. This graph shows how larger parts of the contiguous United States are experiencing unusually hot temperatures during the months of June, July, and August. So there are unusually hot summer days indicated in the red line, and you can see that unusually hot summer lows are indicated in the orange line, and the y-axis indicates the percent of land area that are experiencing this. Not only are we experiencing hotter temperatures in a wider land mass, but hotter temperatures are becoming more common, they're becoming more severe, and they're lasting longer. So these maps compare the differences in extreme heat between the recent past, which was 1980 to 2000, and projections for the mid-21st century, 2041 to 2070. And this is a projected scenario with current greenhouse gas emissions. And the hatched areas indicate confidence that the projected changes are significant and they are consistent among models. And this data is from the United States Global Change Research Program in 2016. So not only will we be experiencing hotter temperatures and effects from heat, but it will also affect our human health. This is from the Environmental Protection Agency in 2015. And the top graph are actual deaths in 49 major United States cities. And this is from both extreme temperatures, so both extreme heat and extreme cold, with extreme heat being the most significant portion of the deaths. And the 2100 projection is a projection with which we are producing business as usual greenhouse gas emissions. So we're not changing and we're not able to substantially adapt or acclimate to more extreme temperatures. And you can see the increased projection of mortality per 100,000 people. So how does this affect us globally? According to NASA, as the climate has warmed, we probably have all heard this, that the ice caps will melt in our environment. And particularly, we have found that in Antarctica and Greenland, we're losing significant amounts of ice at an alarming rate. In the last 16 years, we've lost enough ice to fill Lake Michigan. And to put that another way, we've lost more than 5,000 gigatons of ice. 1 gigaton can fill 400,000 Olympic-sized swimming pools. So, we don't live in Antarctica, we don't live in Greenland. So how does that affect us? That affects us because our global sea levels are rising. This is data from the University of Hawaii Sea Level Center in 2022, and they calculated the global sea levels using tide stations and laser satellites. And what they have found was that the global average sea level has risen 8 to 9%. And the y-axis here is the change in sea level in millimeters. And you can see that it's increasing, but also increasing at a more rapid rate. And for context, projections by Miami-Dade County estimate that by 2040, the sea levels in Miami itself will be 10 to 17 inches higher than in 2000. And this is important because 30% of the United States population live near a coast, and 8 out of 10 of the world's major cities also live near a coast where global sea levels will be affected. So not only does this affect, where we live, how we're experiencing heat, how we're experiencing weather, this also affects our economy. So this is a graph by the National Oceanic and Atmospheric Administration, and it calculates the number of billion-dollar disaster events that are consumer price and inflation adjusted. And you can see in 2023, we had a large number of billion-dollar events, most of them being in the green for severe storms. And you can also see 2 spikes with the red line around 2005 and 2017. And those correlate with Hurricane Katrina in 2005, as well as Hurricane Irma in 2017. So the impact of environmental change will not only have direct impacts, but they will have downstream consequences as well. And they are going to impact our environment and ecosystem, which means that vector-borne diseases will be present in areas where we didn't anticipate them before. Waterborne pathogens may also be a problem in areas where we didn't anticipate, as well as exposure to toxins. So why do we as emergency physicians care about this? That's because climate change can affect nearly every organ system. And as physicians, we should be aware of the health harms that are associated with climate change and be able to address clinical practices and adapt accordingly. So this is kind of a general graphic by the Cleveland Clinic that illustrates how climate change can impact human health. There's 2 components. There's going to be the climate change, which I kind of discussed already, and then the increased air pollution, which will release more particulate matter and impact respiratory, cardiovascular, infectious disease, and mental health systems. And we as providers are aware of this problem, but I think that providers are not certain that it is affecting them right now. So this was a survey done by the Lancet Planet Health in 2021, and it surveyed about 4,600 healthcare providers worldwide and asked them whether they thought that adverse effects of climate change were affecting their patients a moderate amount, a severe amount, or if it will affect them severely in the future. The light blue is moderate amount, so you can see there was a portion of survey participants that thought that it was affecting them. But you can see that the majority of people predicted that adverse effects of climate change would affect their practice. They cited barriers like not enough time to educate themselves, not enough communication and training for how to educate patients regarding climate change, and issues with policy statements that would support them. And not only do we need to be aware of how to treat our patients as our pathologies are changing in relation to climate change, but we're kind of causing the problem, which was pretty interesting to learn. The healthcare sector in the United States is the #2 most energy intensive sector, producing 10% of the US greenhouse gas emissions. Does anyone know what the #1 sector is?
Agriculture and meat, probably, that thing.
Good guess. It's transportation, and that produces 28% of the greenhouse gas emissions. And our specialty in particular, emergency medicine, is likely to bear a large burden of the consequences of climate change. That's because we focus on emergency care, but we also focus on urgent care. And we play a role as a safety net provider for vulnerable populations. And at the same time, we are leaders in disaster medicine. So we have to know how climate change is affecting the epidemiologic shifts of our patients and be able to address this for our patients when they arise. Downstream consequences of climate change also impact our pre-hospital care. We experience more pre-hospital fragmentation. We will experience crowding in emergency departments. There may be ambulance diversion, and we need to have a strong disaster response so that we are able to withstand shocks. So this is a photo that I took of a patient that I know. I'm just kidding, it's a stock photo. This is George. He's an 86-year-old male who comes in with worsening shortness of breath. He's an ex-smoker, he has hypertension, he has hypothyroidism, he has new lower extremity swelling, and a chest x-ray shows that he has evidence of emphysema. His thyroid stimulating hormone and BNP are elevated, and a plan for him would include a prescription for an inhaler, a diuretic, and adjustment to his thyroid medication dose. So this is, a patient that we could totally see in our emergency department. We probably see him every day. So what are some climate implications to a patient like this? So you note outside that the temperature is 89 degrees Fahrenheit and it's really humid. And as you're questioning him, you learn that he has no air conditioning at home. The high temperature is a risk for a patient with pulmonary and cardiovascular disease. And certain medications can contribute to temperature dysregulation and can be damaged by higher temperatures. So accordingly, you prescribe a dry powder inhaler instead of a metered dose inhaler. And you advise George according to access to cooling centers, medication storage, checking the air quality index, and then awareness of the signs of heat stress. So that brings me to heat. So since heat waves are becoming more frequent and severe throughout the United States, we must understand that extreme heat poses a direct threat of heat exhaustion, heat stroke, and increased mortality. They will worsen common illnesses, including asthma, mental health disorders, diabetes, renal insufficiency, and also infectious gastrointestinal disorders, as you can imagine, through increased hypovolemia. This is a great image from the Centers of Disease Control, and it kind of illustrates the progression from heat exhaustion to heat stroke. So initially, if a patient presents with heat exhaustion, they may be dizzy, sweating, nauseous, thirsty. We can kind of treat them supportively by moving them to a cooler area, preferably one with great air conditioning, loosen their clothing. We can give them water. And if symptoms do not improve by 1 hour, or if they start vomiting, then they need to seek medical attention emergently with concerns for heat stroke. And patients with heat stroke are going to be patients that have throbbing headaches, they're confused, they're nauseous, they may have a body temperature above 103 degrees Fahrenheit. And obviously, if they're losing consciousness or altered, then they will need help immediately. We'll want to move these patients to cooler air-conditioned temperatures and then cool them rapidly. One thing that I learned was that using a fan to blow air in someone's direction can actually make them hotter if the heat index temperatures are above the 90s. So this is something easy that we can advise our patients and keep them safe. So who's at risk for heat-related injuries? These are patients that are not accustomed to heat. These are patients that are physiologically vulnerable, like pregnant patients. Maternal exposure to extreme heat can result in premature birth. It can result in low birth weight and can result in increased rates of congenital anomalies. There are two different types of patients, ones that are, not accustomed to heat, so they are vulnerable, and those who are at risk of getting greater exposures to heat. So those are athletes and people who are working in outdoor environments. And then we have patients that are unable to adapt, like elderly patients or marginalized patients with language barriers. Another interesting consequence of heat that I personally wouldn't have thought about until researching this are the ways that heat can impact our medications. So not only does heat impact medications in the sense of patients on current medications may not be able to regulate their response to heat. So diuretics, beta blockers, antipsychotics, anticholinergics, and psychiatric medications in general can impair our body's ability to regulate heat. But there are medications themselves that are not heat stable. So if they are exposed to heat, they're not going to be working for your patients. Those include albuterol inhalers. We may see an increase in respiratory illnesses, so that's something to keep in mind. Epinephrine was another medication that I thought was interesting. There was a study done by the New England Journal that looked at epinephrine and exposure to heat and efficacy. And it found that, limited exposure to heat did not affect epinephrine efficacy, but constant heat exposure made it less efficacious and even made the mechanism of deploying the epinephrine less effective. The rest of the meds there, the antibiotics, the antifungal, birth control, and thyroid medications are simply less heat stable. The next we'll talk about air quality. Climate change has been shown to compromise air quality and respiratory health in several ways. Aeroallergens and pollution are important triggers for asthma, and patients may not routinely monitor air quality and pollen indices to proactively inform their disease management. And both the prevalence and severity of environmental allergies are thought to increase because of longer pollen seasons, more pollen, and the pollen itself is going to be more potent. And that was published by the Journal of Allergy and Clinical Immunology. Climate change will also contribute to air pollution, which will can impair lung development in young children and contribute to the asthma burden in patients of all ages. The higher temperatures will promote the formation of ground level ozone, and inhaled ozone can decrease lung function and increase the severity of asthma. And studies have shown that this will affect patients with lower socioeconomic statuses more disproportionately. So the joint effects of heat and ozone may result in hundreds of thousands of school absences, and it is projected that over 1 million cases of acute respiratory symptoms by 2030 will occur if greenhouse gases continue at the rate that they are. So this is a photo taken by NASA, and this is San Francisco in 2018. And during this year, the San Francisco Bay Area had the worst air quality in the entire world. And this was secondary to wildfire smoke. And particulate matter from these fires reached all the way to Massachusetts. And climate models now suggest that wildfires and associated particulate pollution are expected to increase in the arid West, in Eastern Canada, and also in East Coast cities along the US. Wildfire smoke has a host of pollutants and can affect our health in many ways. It has acrolein, which is a lung irritant, benzene, which is a carcinogen, and also polyaromatic hydrocarbons, which are both a neurotoxin and carcinogen. And so I think it's important to note that you don't have to be directly in a wildfire or in a city with a wildfire to be affected by the consequences of this. So this is an air quality diagram. And if you scan the QR code, you can look at the air quality recommendation for Rochester in real time. And this would be a great resource to give a patient who has COPD or asthma or somebody who's prone to increased allergies to be able to direct them on how to proactively manage their respiratory disease. The last time I checked, Rochester was in the green category, so that's good. Awesome. But you may want to advise your patients to either stay home, to wear an N95 mask, or buy air filters in their homes to protect them from particulate matter. This photo was shared with me by Dr. John Shupak, and this was when he traveled to India. This is an N95 in New Delhi with an AQI of greater than 1,000 after 24 hours. So you can imagine the effects of breathing something like that in, particularly if you're elderly, young, vulnerable. So my point being in all of this is that as physicians, we should understand air quality recommendations and be able to provide appropriate guidance to our patients. Next, I want to talk about exposures. And first, we're going to touch on infectious disease. And this is important because we are having lengthier warm seasons, milder cold seasons. Our land use is changing, and this is going to create changes to vector-borne diseases. In addition, we're having intensified water cycles, and we're having worsening heavy rainfall, which will impact waterborne diseases. And I think that there is this conception that this only affects people in the third world, but there is data that it has been affecting the United States as well. So in terms of vector-borne diseases, this is data from my research, just based on the United States. We are going to see changes in the presentation of Lyme in areas, dengue, chikungunya, and Zika. That's a lot to discuss in a 1-hour topic, 1-hour grand round. So I'm going to focus on one and kind of do a deep dive, but these are things that we should keep in mind when we are worried about vector-borne diseases for our patients. So this is data from Nature, and it recorded the rates of dengue in the Americas, so both North and South America, and noted that the levels of dengue are on the rise. Obviously, there's multiple factors to this. We may just be better at diagnosing dengue. It may be because of a larger population, but nonetheless, there has been a greater number of patients in our vicinity with the disease. And this is data from the United States specifically, and this is from the CDC, and this is just from last year. And you can see that in the fall, we had a spike in, this is not travel-associated dengue. This is locally acquired dengue cases in the United States. So it is something that's present and something that we should be aware of. So case management for patients who we suspect have dengue. The important thing is going to be taking a really great history, mosquito bites, travel history. The patients present in a very vague way: nausea, vomiting, fever, rash. Right now, you need to have a patient that lives in or has traveled to an endemic area, has a fever, plus 2 of the following. And then you can read the warning signs there. There are things like severe abdominal pain, persistent vomiting, bleeding, enlarged liver. They may have fluid accumulate, and they may be lethargic. One of the things that is interesting is the tourniquet test. So basically, in terms of management for them, if they have no warning signs, they can be managed as an outpatient supportive care. If they have warning signs and they are vulnerable, so pregnant, infant, diabetes, other warning signs, they may need inpatient management. And if they have evidence of shock, then they will likely need to come into an ICU and be cared for supportively. They may need blood. The tricky part about dengue right now is confirmation for this disease or vector-borne illness takes several days. We've diagnosed it in our emergency department. I've done it myself, and it takes about 8 days for the confirmation to come back. So you have to have a high suspicion to be able to not only treat your patient, but also direct their family as well. This is something called the tourniquet test. And, this is something that I think is useful in a resource limited setting. And I saw it used in Bangladesh quite a bit. Basically, what it measures is capillary fragility. So what you'll do is take the patient's systolic and diastolic blood pressure. For instance, if it was 100/70, you're going to pick a level of pressure in between that, like 85. And you're going to inflate the cuff, the blood pressure cuff, and leave it there for 5 minutes. Then you're going to deflate it, wait 2 minutes, and then you're going to count the number of petechiae per square inch. And, this seems kind of rudimentary, but it's actually used quite a bit and helps differentiate whether this is something secondary to a vector-borne illness or if it's just like an acute gastrointestinal condition, like a viral condition. This is interesting. This is from the New England Journal, published on February 1st of this year. And this is a new vaccine that's in phase 3 in Brazil. They've done a 3-year double-blind analysis of 16,000 patients. And they have shown so far that this single-dose vaccine has decreased the cumulative incidence of dengue, V1 and V2. And, I know as emergency physicians, we're like, why does this matter to us? You can take a look back during the COVID-19 pandemic and see how we had to adapt, and we were the ones giving vaccines to patients. And so this is particularly important in marginalized patients. And I think that we need to be open to evolving as our needs may change. Kind of based on my personal experiences and experiences in Bangladesh, I got a chance to write about dengue fever. And this was kind of education that I was able to provide for the general population about what people need to know regarding dengue in the United States. And so if you want to take a look, you can kind of see the recommendations that we gave. One of the important things that I want to highlight was that there are a lot of overlapping symptoms between dengue and even COVID. So having a high suspicion, taking a great history, and being able to understand your patient on a holistic basis is really important. Some of the things that we might ultimately end up educating our patients on are the use of mosquito repellents, wearing protective clothing, and then obviously removing standing sources of water that can proliferate the production of vector-borne diseases. This is a list of some waterborne pathogens that have been even identified in the United States. Transmission of pathogens via piped water in the United States has been estimated to result in millions of cases of gastroenteritis each year. And that's because we're having more heavy rainfall, and this is increasing the pathogen load in our municipal drinking water systems. And there are multiple outbreaks that have occurred of waterborne conditions, particularly in children. So climate-driven extreme weather not only provides risk for vector-borne diseases, but also direct injury. So we will see increased rates of trauma as a result. But there are indirect illnesses that are secondary to extreme weather, like toxin exposure. This is a weather surface analysis of Hurricane Irma in 2017. And hurricanes, extreme flooding, they have mobilized things like coal ash and chemicals from storage sites that have exposed people to lead, arsenic, mercury. And this affects our populations, particularly our children, which have been shown to have greater incidences of allergies, GI complaints, and even ADHD in association with extreme weather events. This is a photo of Hurricane Irma in Florida in 2017. And it was really interesting to learn this. In the 9 days following the landfall of Hurricane Irma, there were 91 carbon monoxide poisonings in Miami-Dade County alone. And there were actually more deaths from carbon monoxide poisoning than from direct injury of the hurricane itself. I think there were only 11 deaths from Hurricane Irma and 91 from the carbon monoxide as a result. And that's likely secondary to poor ventilation and generator use. So here are some signs and symptoms of carbon monoxide poisoning. The patient may have headaches, confusion, breathlessness. They may be nauseous, dizzy, tired. They may have stomach pain. And if you can think back to the heat-related injury slide, it's very similar. The patients will present in a very vague presentation. And if we don't have a high suspicion for what we think is going on for these patients, we may miss a diagnosis. This is a photo of a hyperbaric oxygen chamber. And in general, the treatment for carbon monoxide poisoning is 100% oxygen on a non-rebreather. But if you find that the patient's carboxyhemoglobin is greater than 25%, if it's greater than 15% and they're pregnant, if they've lost consciousness, if they have a severe lactic acidosis, or if they have evidence of end organ ischemia, we're going to activate hyperbarics for these patients. Another important thing to think about is, has this patient been treated with hydroxycobalamin prior to arrival to the emergency department? And this may be given for a host of reasons in the pre-hospital setting for like a presumed cyanide exposure. And this is important because hydroxycobalamin has been shown to both falsely increase and falsely decrease carboxyhemoglobin levels. So if you see that this was administered, then you need to keep that in the back of your mind. And also remember to ask this whenever you're getting handoff from your pre-hospital colleagues. Okay, so the last thing I want to talk about in regards to climate change in medicine are the social determinants. And this is probably the most important aspect because these are the patients that we end up seeing in our emergency department. This is a slide shared with me by Dr. Brian Schwartz. He is a physician at Johns Hopkins and a prolific writer on population health and climate change. And I know this is a really busy slide, but I want to kind of draw your attention to the green box. And those are the social mediating factors of climate change. You can kind of see the downstream effects of climate change. We've kind of gone through them already. We'll have extreme weather. It'll be an impact on our mental health, cardiovascular disease, respiratory disease. But ultimately, patients may have loss of their habitation. They may be experiencing increased levels of poverty. They're going to be displaced both internationally and within the United States. The rates of violent conflict may increase, and there may be other social determinants of health that we aren't anticipating that we should keep in mind. So this is a picture of Hurricane Katrina in 2005. You can kind of see the water in the background and the devastation that has occurred. And you can kind of see how these people are kind of walking away from their homes. And I kind of want you to focus on this kid with the water bottle in the front. Let's just kind of think about him. He probably grew up in one home his entire life. That's been uprooted. His parents are, stressed, trying to figure out where to go. His emotional regulation system will not have as much support as it would have in a more stable setting. And it was interesting to learn that almost 2 years after Hurricane Katrina, 300,072 displaced children had not returned home. So you can imagine how this impacts a child's development, ability to make social connections, and their mental health. Disasters also stress the caregivers, like I mentioned before, and it'll undermine support systems for parents. About 24 million people worldwide have been displaced each year since 2008, and this is secondary to extreme weather and climate-related disasters. So having familiarity with behavioral and mental health sequelae of disasters, I think, is a prerequisite for us who are going to screen these patients. And it will allow us to perform trauma-informed care for them. And this is data from the Developmental Medicine and Child Neurology Journal, as well as the American Psychology Association. Among children exposed to extreme weather events, 1/3 of them receive a new mental health diagnosis, and 10% have persistence of symptoms a year after the event. And the medical community is becoming more accepting of the dangers associated with climate change, specifically in relation to health. So in 2022, the American Medical Association has adopted a new policy declaring climate change a global health crisis. And they are working with the National Academy of Medicine in a group that is collaborative to decarbonize the United States healthcare sector. But the World Health Organization, as well as the United Nations, has recognized this for years now. Our very own ASAP has also released policy statements in regards to climate change and action items that they are going to do in order to prevent the worsening of climate change, as well as be prepared to take care of our patients in the future. If you're interested in reading this in detail, I'm happy to share the link. And then these resources were shared with me by Dr. Veda Bellamkonda. This is local places where you can get involved. The picture is me and Dougie at Dr. Moss at the Leadership and Advocacy Conference in Washington, D.C. last year. There are multiple ways to get involved, including in Minnesota, Health Professionals for a Healthy Climate. This is a group of physicians that meet to create action items to reduce carbon footprints in their local systems, but also in the state itself. And then 350 is an advocacy group that's not exclusively for physicians, but really anybody who wants to get involved and do lobbying work and advocacy work. Dr. Veda Bellamkonda, which is Dr. Venk Bellamkonda's sister, is really passionate about climate change in medicine and suggested that perhaps the biggest way to make an impact is inciting local systemic changes. And then, ACEP and other advocacy groups are great ways to become involved and use your voice. I personally think that emergency medicine physicians are poised to be excellent advocates for climate change, just based on where we stand in our expertise and the types of patients that we'll see. And if you want more resources, this is a 10-day curriculum that I found. This is by Dr. Michelle Lin at the University of California in San Francisco. In regards to climate change and medicine. So this involves like videos and PDFs that you can read through and really kind of understand how climate change will affect emergency medicine specifically. So in conclusion, I hope you have gotten a couple of more pieces in your toolbox to counsel patients regarding heat-related injury and respiratory diseases. I hope this expands your differential when you're identifying pathology in patients that are exposed to extreme weather, and not just directly, but indirectly to extreme weather. I hope this helps you understand how climate change can affect the social determinants of health and maybe empower you to take action in whatever way you feel is right for you. I'd like to thank these wonderful mentors who helped me prepare this presentation. Couldn't have done it without you guys. And then my family, who has listened to all of my presentations multiple times, and also the cats. These are my references, and that's it. Thank you.
Thank you so much, Adiba. That was awesome. Thank you, everyone, for listening to this episode and to the show in general. If you find value in what we brought to your life this past year, you can give back to our show and support our mission by submitting a review on your favorite listening platform. And to make sure you don't miss out on any of the upcoming chapters or episodes, be sure to hit the follow button. So, stay warm and stay safe this new year. Take stock of the amazing things you have accomplished and make plans for the amazing things you hope to accomplish in the year 2025. Alex and I sure do, and we look forward to serving up even better educational content for you in the coming year. Thank you for listening.
The Always On EM Podcast.
Emergency Medicine Grand Rounds.